Hello, I'm Dr. John Preston Parry. I am a board certified reproductive endocrinology and infertility specialist, and welcome to my YouTube channel. But anyway, so top question: does sex and orgasm help with fertility? Now, obviously, for the guy, it matters a bit more. If the guy does not, you know, release the sperm into the reproductive tract, it's kind of hard to get pregnant. But for the woman, unfortunately, humans don't ovulate from orgasm. For Now, there are other species that do. Rabbits actually do, and they release all their eggs at the same time. For humans, doesn't work that way. So while we wish there were more incentives, from a reproductive standpoint to help out, doesn't work that way for humans. Although, again, take care of each other and make sure that everyone's happy in the process, because it can be daunting. And if you aren't having fun along the way, that makes it even more difficult. Another thing that I'm often asked about is, does the position matter when trying to get pregnant? And people are saying you have to have particular angles, that if you have a retroflexed uterus, it has to be adjusted. It's not true. So sperm reach the uterus within 2 minutes after ejaculation. They reach the tubes within 5 minutes and reach the peak concentration in about 10 minutes. And if sperm lived for 72 hours, you know what? You don't need to have the fact that it got there in 1 minute and 50 seconds instead of 2 minutes and it lives for 72 hours. It's not changing anything. So I wouldn't worry too much about that. When should you have sex to get pregnant? I mean, everyone wants to know that. How do I time things? And people almost create this fertility fire drill, where the LH predictor kit becomes positive and everyone's saying, go, go, go. Doesn't work like that. If we had to be that deliberate, we would have died out as a species. So if you want to know when to get pregnant, here's the thing. Mid-cycle, when people ovulate, sperm typically live for 72 hours. So if you have sex Wednesdays, Saturdays, there's almost always there sperm for whenever an egg releases. So you don't have to be that deliberate about it. Or you could say the 11th, 14th, and 17th days of the cycle, with day one being the first day of full heavy flow for people with reliable and predictable cycles. But again, Wednesday, Saturday, keep it simple. And if you're having to do more than that, something may be wrong. If 75% of women are successfully pregnant in 3 months, and it hasn't happened in 6, 9, 12, you should have been pregnant 3 to 4 times. Maybe something's going on. That's where you should get things evaluated or look into it. Now, another thing people often ask is, how often should we have sex to improve the chances? I have couples coming into the office, both of them sore, barely able to walk from trying to maximize the DNA in the reproductive tract. And again, people are in the mood for that. I won't interfere, but it doesn't really change things. Anyway, that's a lot, short period of time. If you think there are other topics we should do, let us know. Like, subscribe, comment, share, and also visit positivestepsfertility.com to contact us directly. And again, don't suffer in silence. You're not alone. So many people are going through this, and support everyone who wants to have a family.